All right. Hello and welcome everyone. I'm Tiffany and I'm part of the medical team at Myovant Sciences, which is a biotech company focused on elevating women's health. So today I have the pleasure of moderating a discussion with our esteemed panelists, Dr. Jessica Shepard and Tanika Gray Valburn, and we'll hopefully be shedding more light on something that normally doesn't get a lot of attention, uterine fibroids. So at Myovant, we believe that the status quo in uterine fibroids is unacceptable. Identifying and addressing the root of the problem is critical to changing this much ignored area of healthcare. And that root is lack of conversation and lack of awareness around menstrual health in general and uterine fibroids in particular. So we're thrilled to be part of the Healthy Churches Conference efforts to elevate the conversation and center women with uterine fibroids in their journeys and enable them to live their lives to the fullest. So events like these have a ripple effect on the community. The number of girls and young women and young men who may see these events and learn about what a normal period is supposed to look like may enable them to recognize symptoms of fibroids much sooner and seek help. So my hope is that we come together as a community, we take the opportunities to advance these important but sometimes difficult conversations and to start to solve the entrenched taboo and stigma regarding women's health. So I'm a big believer that together is always better. Therefore, the more conversations and collaborations we have to highlight the impact that fibroids have on the lives of our friends and loved ones, the better chance we have to move forward together. So thank you so much for joining us today. And now let's meet our panelists. So to start, it'd be great for Tanika and Dr. Shepard, if you would provide a brief description of your background, what brought you to your current work, and why you decided to join for this event. So Tanika, perhaps we start with you.
Absolutely. Well, thank you so much for having me. Thank you for that wonderful introduction. As you were talking, I really thought to myself, how important it is for us to have many of these conversations around uterine fibroid awareness and advocacy. Like mentioned, my name is Tanika Gray Valburn. I am the founder of the White Dress Project, and we are a nonprofit fibroid awareness and patient advocacy organization. I'm so pleased to have the opportunity to be speaking with all of you and the Healthy Churches community to ensure that uterine fibroids awareness, advocacy, and action is really a national and international global conversation. At the White Dress Project, we are committed to providing our warriors a sense of community. It is so important to us that we foster that, because we want every person who lives with fibroids to share their story and to help break down the walls of silence and really shatter the stigma and myths that are around uterine fibroids. I started this organization out of my own very, very personal journey, which I'm sure we'll get into with the conversation with Dr. Shepard. But it was really important to me when I started to feel very alone in this. And I had a myomectomy, removed 27 fibroids in that invasive surgery. And during my recovery, I thought about so many things, but one of the things that I thought about was the fact that I didn't own any white clothing. And I immediately recognized how I had sacrificed many of the things I like, many of the things like fashion and dresses, and just how I had accommodated my life to these benign tumors and never wore any white because of all of the excessive bleeding, the bloating. I just didn't want the embarrassing moments. So I understood alone. And even though my mother suffered with uterine fibroids, I had known her story, I just couldn't understand why people weren't talking about this on a national level. Like we weren't walking or running, or there was no legislation. So when I didn't see any of that, I created it on my own. And we wrote the first and only legislation to declare July as Fibroid Awareness Month, which has been introduced in the US House multiple times. And we've worked with many congressional leaders, most recently on the introduction of the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021. So I could go on, but I definitely want to give Dr. Shepard an opportunity. And as we talk and converse today about the work that we're doing around uterine fibroids, I hope that you will feel inspired and empowered. And even if you are not someone who is suffering with uterine fibroids, I promise you that you know someone. So just by being here today, you can be an advocate for yourself and someone else. Thank you.
That's great. Thank you for that, Tanika. And Dr. Shepard, perhaps we hear a little bit about your background, your experience in fibroids, and what brought you to this event.
Yeah, I'm very excited to be at this event because I do believe that conversation is really where we start to make change, allowing people to share their experiences. And as Tanika just said, may not necessarily be an individual experience, but someone that someone in your family, and being able to, empathize with someone who might be going through the situations that fibroids may bring to someone's life, because it really does impact, a lot of different women's quality of life in different ways. My name is Dr. Jessica Shepard. I'm a board certified OBGYN and also minimally invasive gynecologist. This has been, something that is what we call the bread and butter of GYN. It is something that we see every day in our offices. Now, over the last, I would say 10 years, I really have taken the passion of fibroid awareness into my practice and on my personal platform, because I do believe that it is something that needs to be discussed. It needs to be yelled about, shouted about, partnering with, patient advocacy groups such as the White Dress Project, and also organizations all over the US and also over the world that are really trying to bring awareness to fibroids, because it really does have an impact on not only the women who have it, but also the families. This is, something that is a public health issue. It has social and economic consequences. And what we found when we think of fibroids in general, because it impacts more so a greater proportion of African American women, is that we see that there is also a cycle of poverty and gender inequity and physical and social suffering that we really have to stop. And so I'm, motivated to use my platform and my experience treating women, and whether that's through medical management or surgical management, is really to bring to the forefront the ability for women to feel empowered to talk to their healthcare providers, and also, what information we share with our family members and our friends, and really driving women to be motivated to seek care and not feel any shame or embarrassment by the symptoms that women feel through fibroids. So that is me in a nutshell, and I'm very delighted to be in this setting, on this forum and platform, to again allow women to feel not alone.
That is great. And I love how both of you mentioned that it's not just the woman's issue that's dealing with fibroids, it's also her social circle, her family. It's a community issue, and we need a unified community to help solve this problem and raise awareness. That's wonderful. Why don't we get into what uterine fibroids are? Because I think we've thrown that term around, but Dr. Shepard, perhaps you could give us a brief summary of what fibroids are and the most common symptoms associated with the disease.
Absolutely. I think that's a great place to start to kind of build the foundation. I think that there's a lot of misinformation out there, and, our job really is to kind of streamline that information, make sure everyone has very accurate information. But fibroids really are the most common benign tumor. They're benign, not cancerous, benign tumor of the pelvis. And when we stratify that to numbers, up to 50% of women across all races will experience a fibroid, not necessarily a symptomatic fibroid, but a fibroid by the time of the age that they're 50. Now, when we take that demographic to African American women, that number is going to jump up to your higher 70th percentile and even in the 80th percentile of how many Black women have fibroids. Now, that again is the clinical definition of what fibroids are as far as a tumor. It's a smooth muscle cell tumor. But we also were going to get into what that presents for the woman as far as symptoms, and then also no symptoms, also known as asymptomatic. And we'll get into that conversation. But that is the kind of general definition of what a fibroid is.
Okay, great. And how do patients usually experience these types of symptoms? Could you talk a little bit more? We hear a lot about heavy menstrual bleeding. Perhaps talk about that a little bit more.
Yeah, what the most common symptom, that women come into the office for is going to be heavy bleeding. Now, that bleeding is usually typically during their menstrual cycle when they'll have heavier bleeding. That, again, I've heard women coming in when they are on their cycles that they line their mattresses with plastic liner so that it doesn't leak through. Or making sure, like Tanika said, when she was really going through the worst of her experiences, she realized she didn't have any white in her closet. So you have women that will forego social events, going out with their friends or their family during their cycle because of the heavy bleeding. But in addition to the heavy bleeding, you can have additional symptoms such as pelvic pain, heavy cramping. It can impact, your bladder if it's, a bulk symptom or the fibroid is very big and it's resting on the bladder. You can have some urinary incontinence issues as well as bowel issues, and also fertility. We will obviously, dip a little bit into the fertility realm during this conversation, but it can impact fertility. I always do like to say, because this again is something that women maybe have a condition and they get diagnosed and never heard of, but when it comes to fertility, does not mean that if you have fibroids that you're going to have a fertility issue. But what we do find is that for women who might have a fertility issue, fibroids might be the cause. So I always like to make sure we don't have women, again, scared, because we really want women to know the condition that they have and what are all the options around it. But it does not mean that if you have fibroids that it's automatically a fertility issue.
That's a good point of clarification. Thank you for that. And Dr. Shepard, you mentioned that the prevalence is higher among Black women. Tanika, going back to your experience as a patient, can you walk through a little bit more about your patient journey as a Black woman looking for a diagnosis for fibroids?
Yeah, that's a great question. And I think to Dr. Shepard's point about Black women being disproportionately impacted by fibroids, it's important for us to share the Black experience, right? So as a Black woman, I feel with fibroids, I feel qualified to do that. And when I think about how my journey to diagnosis and really how I dealt with dealing with the symptoms of fibroids, it's really a long journey. For me, I feel like I started to have symptoms of uterine fibroids probably around the age of 14 or 15. And sometimes that goes contrary to the literature, because usually the literature suggests that, fibroid symptoms present around your reproductive years. So that would be older, like 20, 25 or so. Dr. Shepard, please correct me if I'm wrong. But I really started to experience these symptoms in my mid-teens. And I always say that I was always that young lady who, if we went on a road trip or something, I was always the one who needed to stop at the bathroom. I was always the person who had an extra bag with me with pads and leggings and clothes. So for a long time, I just thought that this was what a period was like. This is what a normal period was like. This is what a woman's journey was like. And as I mentioned before, my mom had fibroids, but I still didn't make the connection when I started to experience these symptoms. Fast forward to about the age of 19 or so, I had to have a DNC. And that was the recommendation from the doctor at the time, who was a male doctor, who told me that he could not understand why I was bleeding this way. Obviously, that was extremely devastating for me, because I had to explain to my mother, to friends, like, I'm not having sex. This is the procedure they tell me to have. Because at that time, that procedure was particularly to remove matter, right, from your uterus. So, and Dr. Shepard, I may be all over the place with this, but the point is, I was given that as a treatment option for my heavy bleeding. Subsequently, it didn't help. I still was going through heavy bleeding. I was extremely anemic. By this time, I probably had 4 or 5 blood transfusions, and no one could tell me why I was bleeding. It wasn't probably until the age of around 25 or 26 when someone said to me, a doctor said to me, has anyone ever told you about uterine fibroids? And I was like, you mean like what my mom has? I'm no, I can't have what my mom. I don't know why it was so foreign to me. And at that time, I was told to watch and wait. Fast forward, I am getting married. I get married, and we go to a doctor, and this doctor tells me that I need to forget about fertility, save our money for a surrogate because my uterus was way too compromised. And that's really where the journey started for me. So even though I had gotten that previous diagnosis, I still didn't get what I would consider proper care or a treatment plan. And I think this is really why I'm such a big advocate for advocating for yourself, right? Not every doctor is like a Dr. Shepard or like the doctors that we interact with at the White Dress Project who have that level of care and want to ensure that all their patients are an advocate for themselves. So for me, it was years and years of dealing with the symptoms, but not being properly diagnosed, and then being told to watch and wait. And I think at the point that I was told to watch and wait, my symptoms were already invasive. Like I said, I'd probably had around 4 blood transfusions by this point. My fertility was probably in question at that time and didn't even recognize. So when I look back at that, there are definitely some things that I wish would have happened differently, and I would have been taken more seriously. And the bleeding and the pain that I was experiencing, I would have had more advocacy within myself, but doctors around me who understood that they needed to dig a little further. And now I'm at the age that I am, still have the greatest desire to be a mother and still on my fertility journey. So if I can impart anything, from my story, or if I can inspire anyone from my story, it's that you really have to become your own best health advocate. And that doesn't always mean alone, but it means getting a tribe of people who understand and are invested in making sure that you have the best representation, you have the best information so that you can make the best choices for the outcomes that you want.
Definitely loud and clear. It sounds like you had symptoms pretty early on as a teenager, and then what was it, a decade between the symptom onset and before you actually got a diagnosis?
Yeah.
Unacceptable. I mean, yep. I want to ask, how do you think stigma plays into the conversation about what a normal period is and uterine fibroids?
That's such a great question because it's something that we deal with in our community very often. There are so many people who we meet who say, thank you for the work you're doing. Thank you for the organization, but please don't share my story. I only want to talk with you. And I think that is just stigma that has been built over the years because of this condition. And I don't think that it's only uterine fibroids, but because there are so many cultural barriers, because there are so many societal barriers around what women should be talking about, especially when it comes on to our reproductive health, we have just built so many barriers to free conversation around this. There's this meme that's on Instagram that talks about when we go to the gynecologist, like, why are we like folding up our underwear, putting it in our purse? Dr. Shepard and I always joke about that gynecologists don't care, but it's just a simple illustration to think about how as women or as people, when we go to the gynecologist, how we have some of these innate and built-in thoughts around our reproductive health and what we can converse about. So just think, if we're hiding our underwear, if we are, not talking about reproductive health, then bleeding and what's happening in our uterus outside of a baby, nobody's trying to talk about it. And I grew up in a Jamaican household, so very strong island-based. We don't talk about issues below the belt. Our organization is here to say that we really have to eliminate that. Because when we begin to talk about the stories, talk about the embarrassing moments that we have, we recognize that we are much more alike than we are different. I cannot tell you the amount of support and DMs and emails that I received when I decided to share my story. So we really have to eliminate that as women, as a society, as a culture, because it's really a detriment to us when we don't share, and the stigma just is perpetuated.
So true. Yeah, we do definitely need to give every woman a voice and normalize the conversation. Tanika, you also mentioned that you had multiple blood transfusions for your symptoms, which sounds pretty severe. Dr. Shepard, I wanted to ask, what are the most worrisome signs and symptoms of fibroids, and how do you counsel your patients on when to seek care?
Hearing Tanika's story, and I've heard it so many times, but every time she, shares her story, which I'm so grateful that she's able to do that, there's always like one new thing that I hear, and I'm just like, man, this is such a complex story, and to hear her personal journey. But heavy bleeding is one of those symptoms that a lot of times we are very concerned about, because I think that women in general may brush off some of the symptoms or or signs that they have from these symptoms, such as anemia. Going to the ER multiple times for transfusions is not the way that we would, in our optimal view of how patients should be taken care of, is what we would want for them, because we would want to address, again, their bleeding. Or we've had patients who have a lot of pain from their fibroids. And again, it is the same scenario of going to the ER multiple times and being treated again with just pain pills. But that really, kind of brings up the whole healthcare situation. And, quite frankly, as a Black female physician, what we're seeing specifically when we're talking about fibroids, and we could, carry this over into other health conditions, is Black women and how they're treated when it comes to healthcare, and how they're not heard, and the perception of, for example, how they feel pain. So, when patients come to my office and discuss treatment options, and one, they may feel a little bit hesitant to talk about their pelvic issues, or, in Tanika's instance, who I've heard from many patients as well, when they're talking about options of what to do next, they're really only given one option. We have the studies that show, basically Black women undergo hysterectomies and more invasive procedures when we think of the modality of how it's done, like an open hysterectomy versus some other minimally invasive options, at a higher rate than white women. So again, there's this narrative of racial disparities. And again, how we are able to change that's a foundation, a systemic issue, that if we're, again, able to work on that part of it, we'll start to see some of these other things change, is how Black women are heard. What route of options are they given when they go to the ER, or even to their gynecologist, what options that they're given. So there's that perspective of it as well. And when we look at just ER visits alone, the researchers at University of Michigan analyzed more than 487 million emergency visits by women in between the ages of 18 through 55. Looking over the course of relatively 11 years, 2006 to 2017. And the number of ED visits from fibroids among that age group more than doubled during the study period, up from roughly 28,000 to 65,000. So there's something that's driving these numbers. And again, when we think of Black women and symptoms, it's also seen in studies that heavy bleeding or pain is actually seen more in Black women because they tend to have more fibroids, but also the size of their fibroids are significantly larger. So that's going to impact the side effects that they have and the symptoms that they have. So this goes again into research. Why is fibroids not high on the research list when we think of health conditions that are researched? and having to work so hard to get a bill, brought onto the floor and accepted, because this is something that impacts, we said again, 80% of women have fibroids. Doesn't mean all of them are symptomatic, but the ones that are symptomatic, which is roughly 28 to 31% of that 80%, are having severe symptoms. We see it in the ER visits. We see it in hysterectomies. Hysterectomies, again, when we think of a GYN surgery, it's one of the most commonly performed procedures. And so if you take that, the most common reason for having a hysterectomy is fibroids, which is probably heavy bleeding, and more Black women have fibroids than any other race. So as you can see, this is again a very high surgical outcome for Black women. But what was that conversation in between showing up with a symptom and being given the option of a surgery and then having it performed? There's a lot to unpack in that. And that's really where these conversations sometimes need to focus, because we know a lot about the symptoms. They're already there, right? That's what they are. They are what they are. We know that it's a disease that impacts the uterus, but dissecting the conversation into why these are the outcomes, and what we can do to decrease some of the symptoms that Black women have when it comes to research and looking at innovation and medical management and even surgical management, like that innovation that drives treating this condition in a different way, in a better way. Those are the things that we have to really unpack in these conversations so that we can start to make change.
That sounds, yeah. Oh, sorry, go ahead, Tanika.
I just wanted to add one thing to that, because I thought that was so profound, what Dr. Shepard said when she pointed out, the systematic issue within healthcare, and I think when anyone is listening to this, they can say to themselves, well, if it's a systematic issue, then what can I personally do? But I think that goes back to ensuring that you're telling your stories, because if we don't have those experiences, then we can't gather data from those experiences, and then therefore we don't have the data. So that's why it's so important as an individual to share your story. I didn't talk about, my multiple blood transfusions, the DNC being a treatment option, me being told to watch and wait, then other women wouldn't have that reference point to identify with. So I think how you change the system is by telling the system what you've experienced and what you don't like about it. And then we can begin to advocate for more conversations around why this is not effective, whatever the system is.
And just, to kind of carry on that, exactly what you said, sharing the stories. Research requires numbers. There's power in number. When Tanika, goes on the Hill and advocates for legislation or research, what really makes that impactful is the stories that are shared, the number of stories, and the amount of support that we see from the community. So, never think that you have to be the worst case scenario in order for you to make change. This really can require even men advocating for their wives, their daughters, their mothers. And that's really, where we want to see community coming together, because this is something that's impacting the community in more ways than one would think.
Yeah, great advice. I guess, on that topic, Tanika, your organization emphasizes that there's no one-size-fits-all solution to fibroids. So what are some ways that you can support your community in figuring out what is going to work for them?
Yeah, I think that's a great segue to, what Dr. Shepard's last point about the importance of community and the importance of understanding your tribe. I'm sure that, the Healthy Churches is a large community, and I'm so grateful that they thought it so important to have this conversation or include this in their national conference, because as I said earlier, I promise you there is someone who is impacted by uterine fibroids. I think one of the ways that we can once again foster this community is by I sound like a broken record, but sharing your story. And does sharing your story always mean, in a public forum? Not necessarily. It means sharing it with your girlfriend, and then your girlfriend agrees with you and shares it with her mother, and her mother shares it with with her sister. And that's how community is really built. I also think that understanding that the doctor that you are going to right now doesn't have to be your only doctor is paramount. When I really think of how I look at my healthcare providers, I look at it as a board of directors, as a team, and I am the head of that team, right? So that I always joke with my doctors to say that, no, I didn't go to medical school like you, but I definitely have a level of expertise about my body. So with your medical expertise, my expertise about my body, we can couple together and come up with the grand plan and the grand outcome that we both want, right? Because doctors want to see success from their patients and want to aid in their patients' outcome. And I want what I want, right? So I want to be healthy. I want to be a mother. Or if you don't want to be a mother, I don't want to remove my uterus. There's so many options that we all have. So knowing that if the doctor that you are seeing is not serving you well, then you have the opportunity to go to another doctor to seek second opinions. Dr. Shepard has been in my personal board of directors, and I don't even think she has ever examined me now that I think about it. But every medical decision that I am making, I know that I have her in my corner to bounce an idea off of, to send a text to her, to email, hey, can you look at these labs? I have like 4 or 5 of those women gynecologists in my life outside of my primary care gynecologist. So I think it's important that we build a tribe like that. And that is where also community comes in, right? Because joining an organization like the White Dress Project, you can connect with doctors like Dr. Shepard who are committed to advocacy. They're also committed to ensuring that we have proper patient care, that some of the stories like mine are not stories that are, you know, reciprocated from individual to individual. So that's where community and knowing that you are not alone, knowing that you do not have to suffer in silence, all of those things come in. You know, we could talk a whole nother hour about the political and policy and legislation portion of this. When I first started, I had a member of Congress tell me that, you know, say to me, Tanika, does anybody die from uterine fibroids? And I was so taken aback by it because I was like, why does death have to be, you know, the standard for uterine fibroids patients for anyone to seemingly care? And I went on to tell him about my multiple blood transfusions. We all know that any surgery is not foolproof. You know, even though myomectomies are over safe, surgery is always a risk. We have heard from people who talked about losing loved ones due to, you know, surgery gone wrong. So when we think about the policy and the legislation part, as Dr. Shepard said, it is so important to make sure that we are sharing our stories on the halls of Congress and letting those people know, especially the male members of Congress, that this could be your daughter, it could be your sister, it could be why your wife is experiencing the problems that she's experiencing, and maybe you all haven't even spoken about it as a family. So this, when I think of uterine fibroids, I don't just think of this reproductive health issue. I think of something being impacted on the woman as a whole, and then how her representation impacts other parts of her life. So how does she show up at work? How does she show up as a friend? How does she show up in her community? And I think once we begin to recognize that as a public health crisis and public health issue, how if the woman isn't whole, then we got bigger problems.
Absolutely. As half the global population, if women can't operate or perform and do all the things that we need to do to take care of society and our families, that's going to be detrimental to everyone. So thank you for that.
Absolutely.
Now, Tanika, you mentioned being the chair of your board of directors. I love that advice. And for folks joining, I think they'd be interested in hearing what other advice would you give a person who thinks that she might have fibroids? What would you say to her?
Oh, that's such a good question. Because and it makes me emotional because I think back to, we don't want to live with any regret in our lives, but what could I have done differently, especially as I continuously think about my fertility journey? What could I have done differently? What could I have done earlier? And I really think about this idea of self-advocacy, right? So self-care is really trendy right now, talking about self-care, get a massage, take a bath, for yourself. But when I think of care and self-advocacy, it really is a lot of internal work and thinking about being in tune with your body and recognizing some of the things that are going on with your body and documenting those things. One of the things that I would encourage anyone who may think that they're experiencing uterine fibroid symptoms is to write those symptoms down and journal about them. Because I think what happens when we get into the doctor's office is that doctors have a role to fill, right? They have an allotted amount of time with you. We can't sit and converse about daisies and roses all day long, right? So you have to be very clear with them as to the ailments you're having and what you want to address in the moment and what you want your outcome to be. And I think if we understand that and look at the conversation as such, then we get a lot of outcomes and answers that we're looking for. So the journal entries and writing down your symptoms can aid that conversation, and it can allow that conversation to go a lot more fluid, right? A lot of times, the idea of heavy menstrual bleeding is kind of ambiguous because, what's heavy to me is not heavy to you. But I usually take a picture, and, it wasn't always the prettiest thing, right? But I would take a picture of my pads and to illustrate how extensive or how much blood had filled the pad within an hour. And I think that if you don't have those clinical terms that doctors sometimes use, that those illustrations are very, very helpful. And Dr. Shepard's right here. She can let us know if those things aren't helpful, but it has proven to be helpful in my journey. So definitely journal. Number 2 is find your tribe and find a support group. In the pandemic, we have heard from so many women who have talked about, I got on Zoom, I was so flustered by all the technology, I forgot to ask my questions, all of those things. It's so important. If a friend can join you at the doctor's office, bring them along. Because the emotion of hearing the diagnosis, the emotion of what am I going to do about my fertility, all of those things can be overwhelming. I forget to write them down. Did she say I needed surgery? What can I do next? But if you have a friend there with you, they can take some of that burden off of you. So where are we? 1, down journal. 2, get your tribe. 3, you are, as I always say, the CEO of your body. If your doctor's not working out for you, find someone else and really get that board of health practitioners, which, by the way, should include a mental health professional. I'm such an advocate for therapy. So not only your OBGYN, not only your primary, but your internist, your gastro, your functional medicine doctor, like all the people, get them all together and let's see what's going on with our health. So to answer your question, 1, tribe, 2, journal and make sure you understand what's happening in your body, document those things, find somebody else if they're not working out for you, and really put together your board of directors for yourself and know what you want your outcomes to be.
Those are great tips. And along those lines, Dr. Shepard, can you talk to us about ways patients can prepare for a productive conversation with their doctors?
So I think Tanika hit the nail on the head, is really finding a way to make the information, doctors really are about metrics. We're like, okay, where are we here with this, so we know where we want to go with this. And that's not to the patient's fault. Patients want to talk, they want to ham it up and talk to us, but we are like, we've only got a certain amount of time, and we want to maximize that with what are things that are bothering you now, and where can we take that? What things help is exactly what Tanika said, is how often I bleed, whether that's, some people bleed actually, more than 7 days, or they bleed twice a month. Those things are very important to us because that helps us capture in our mind what we need to do. And then also, if you've had transfusions, if you've had surgeries, but also I think sometimes directing the conversation where you want to be is very helpful to us, because there are some people who have different ideas of what they're trying to capture. And so if you're very upfront with that, doesn't mean you can't change your mind throughout the process. What that really means is you need to be able to direct the journey based on what you've projected to your healthcare provider and physician. And that means that if you're both on the journey together, because you've kind of laid out where you would like to be and where your goals are, that's so much easier for us to navigate that journey. And I think that sometimes, we are, we're guilty of maybe, here's the disease state condition, this is what it is to, treat that. But that doesn't necessarily mean that how you get to the treatment is going to be the same for everyone. And so I really, that's why I love working with Tanika, is that we together, from a clinical perspective and then from a patient advocacy perspective, have been able to curate this message that really speaks strongly to both healthcare providers, but also patients, so that we can really refine this conversation and allow it to be much more productive than just not doing anything at all.
Sounds good. So I want to go back into some of the conversation earlier about racial disparity. We started this conversation about differences in outcomes and disease management by race. Dr. Shepard, what do you think are some ways that we can push for change in standardizing care?
Yeah, that's really, we had spoken about it, previously, about systemic issues that really are impacting the healthcare system. This is something that needs to be penetrated from top down, seeing from how insurance companies designate who can get a treatment versus who can versus who can't. Kind of hospital stays, what is covered in insurance versus not. So, there's so many different buckets of that. Or, for example, resources that a hospital may have in a certain community versus not. What budgets hospitals are willing to spend on women's healthcare is also another thing. If you look at, taking it a little bit out of the subject, but infant mortality, maternal mortality, a lot of times if you're able to stratify really where that happens, a lot of times you'll find it's in neighborhoods that maybe don't have the same resources that other hospitals do. Or, when you look at the healthcare professionals that service a hospital, again, they may not have as many to cover, or as many nursing staff to cover, certain. So that's now at a hospital level. And then, for me being a physician, I always, like to be introspective with myself, but also with my profession as well, to make sure that we're reaching the highest standard of quality with patients, patient care, and also making sure that we're not turning a blind eye to healthcare disparities. It's something that we all know about, but sometimes individually, we all need to ask ourselves, what are we doing individually to make sure we counteract that system? Because it's much easier to address the situation when it's a known. Yes, we know it's there. but also taking the steps individually, because individual actions taken can surmount to a very drastic move. But if we're not taking that accountability, sometimes that's where we fall flat. Just having statistics and numbers out there is not necessarily going to drive us to change that system. And then lastly, I would say research. Tanika had touched on this a little bit earlier about, I think there's various pillars here when it comes to research. Is one, we need to advocate for more dollars. Again, that's going to take everyone's participation in sharing stories and having large amount of people advocate for research. But also, when we think of research and having more Black women in research, and and for other disease state conditions, having people of color in those actual studies, that's where we're really going to see what we can do to make change, because we have the numbers and we have the women who are being impacted in the actual studies. So those are, just kind of a very superficial discussion on what are the things that actually impact exactly what we're discussing here, is that there's so many levels to it, and we have to be willing to address all those levels.
That's a great point. And I love your takeaway on, we all have a role to play in improving the standard of care. We all have a role to play in tackling racial disparity and equalizing access to healthcare. So thank you for that. Tanika, I want to go back to you. You gave some great tips and great advice on how to prepare for a conversation for a patient who might have fibroids and to be a self-advocate. For folks joining us, you have the advantage of listening to Tanika and Dr. Shepard. But for some of the other groups, I'm sorry, let me backtrack. Who are some of the other groups that you think we might be missing with education? Who are some of the other groups that we do need to target?
Yeah, that's a great question, Tiffany. And when I think about the groups that we're already touching, I feel like no one is exempt, right? So it could be a very exhaustive list, but I think that's where we need to go. I think we need to have this conversation in every community, every region, every subset that we can. Earlier, Dr. Shepard mentioned about men. And we just at the White Dress Project, we just did a week of how to involve the male in your life in the fibroid conversation. Because once again, we don't have healthy women, we don't have healthy families and communities. And if we don't allow our men to understand what's going on in our bodies and really also serve as an advocate for us, one of those places is in the workplace, right? And in Congress and in legislative spaces where men are dominant, then we are going to be missing the mark with that. So I think the male conversation is very important, making sure that in every juncture we are sharing our stories with them and we are allowing them to understand. Like I alluded to earlier, I am absolutely thrilled to be here because the church, especially in the Black community, is such a pillar and such a focal point, right? They have so much influence. So I think, how do we get the rest of our churches and our, other religious entities involved in having the health conversation? Because you obviously, are involved with people and healthy conversations are happening in and outside of the church, whether we are privy to it or not. So once again, I just want to applaud healthy churches and the Balm and Gilead community for ensuring that this health conversation that, as we alluded to earlier, can be considered stigma and can be considered taboo, ensuring that we have these conversations in spaces where people are showing up. I often think about having these conversations with our younger generation, college-age students, high school students. As I mentioned before, my symptoms started mid-teens. So if I had had this information prior to, how would I be better armed to understand my health journey and to be a better advocate for myself? So education, legislative spaces in our churches and our religious entities. And I think we need, most importantly, be making sure that we're having these conversations within the family, right? There are so many times we hear from our community members who say, they were being rolled into the operating room and their mom says to them, honey, don't be alarmed, don't worry, you'll be okay. I had to have fibroid surgery too. And, we've heard like, Mom, why are you telling me this when I'm being rolled in? I've never heard you talk about this before. So it's so important that we cannot leave out the family as a unit and as a unit that has to have these health conversations, because it starts with the family. It trickles on to school, it trickles on to our organizations, it trickles on to our communities, schools, and churches. So most importantly, the family, but really no group is excluded from the health conversation, particularly the women's health conversation.
We need to bring in a diverse crowd is what I'm hearing. Absolutely. And I wanted to kind of close out with maybe one final question for the both of you. What do you think are some concrete steps that those who are listening today can take away from this conversation to improve their uterine health? What do you think that main step would be? Perhaps we start with Dr. Shepard.
Yeah, I think concrete steps is being true to your health as an advocate. There are so many women out there who are suffering in silence. And I think that sometimes they suffer in silence because they've been told, one, that's something shameful. Two, a lot of women don't know that this is something that can be addressed. Just even if it's something symptomatic, or if it's the way you feel, or if it's an unknown. I think sometimes there's a fear of an unknown. And I would like to encourage, the women and men who might have someone that they know who's is either suffering in silence or has a fear of what this may be or what may be the next steps, is really to be encouraged and empowered to step out of that and speak to someone. I think that there are so many avenues of how people can reach out and speak to someone. Many of my patients actually, as I deliver sometimes very heavy clinical news or a diagnosis or a treatment plan, whether that's medical or surgical perspective, it's a lot to take on emotionally. And many of my patients I've sent straight to the White Dress Project as somewhere where they can share a community with someone who's going through something similar to them. But when people hear other people's stories, there takes away that barrier of I'm alone or I'm not being heard. And it allows actually a lot of other ideas to be shared amongst treatment plans that they maybe never have heard of, or recommendations. Many of the community, I'll go back to Tanika and be like, did you know that, there are people who advocated for someone else who may say live in Texas where I live, and sent them to me because of the community that's shared. So even people have come to my office because they may not have been able to know I was there or been able to find me. And because of the community that there is in the White Dress Project and other organizations as well, they were able to get the care that they needed because they were able to share with other people. So, for me, in conclusion, the takeaway for me is, for anyone listening who may be suffering from fibroids, for anyone listening who may know someone who's suffering from fibroids, is to start the conversation, whether that's with yourself, whether that's with someone you care about, to take into your hands your own health. Because many times when we do sit in silence or in shame, many times when we do find that courage to maybe say something, it again is not necessarily too late, but the list of options on what we can do to help can be limited. So I would just encourage people to really take heart of this message and this conversation that we've had today, to find the courage within themselves or give other people the courage to speak up.
Sounds good. And Tanika, what about you? What are your thoughts in terms of concrete steps or takeaways from this discussion?
Yeah, I absolutely love what Dr. Shepard just said. It may sound like, we've repeated the same thought about community and self-advocacy, but that's because it's that paramount, it's that vital, it's that important to this conversation. And if you take nothing else from what we've said today, I think a concrete step is turning to your neighbor right now and asking them, have you heard about fibroids? What have you learned today? Do you know someone suffering with fibroids? How can I help? How can I be of support? Because we cannot underestimate, as we have said throughout this conversation, the power of the community. And you may, not be experiencing uterine fibroids per se, but you may have had a doctor who had wonderful bedside manner and you want to refer them to someone sitting right next to you right now. You may have had a great surgical experience and can help someone. You may have that great doctor in your family. And all of that starts with what Dr. Shepard said, which is the conversation. And if we're not having the conversations, then we don't know what's going on. So concrete steps: turn to your neighbor, like we always say in church, turn to your neighbor and ask them to talk about this exact conversation that we've had. Go out in the parking lot and have it with your young people in the church who are so creative and doing so many things and so excited about life and career, but we want them to also be thinking about their health. So have the conversation and then get involved in legislation. As I mentioned earlier, our organization has been involved with the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act that was introduced by Congresswoman Yvette Clarke on the House side, and on the Senate side, Senator Cory Booker and Senator Shelley Capito. So reach out to them, tell them you want more done with it. And just as a point, this legislation would give $150 million for 5 years to our government agencies to research uterine fibroids. And also, what we talked about earlier, why it disproportionately impacts Black women. So get involved with that. Let your member of Congress know that this is something of interest to you. Many times when we have these conversations with our members of Congress, they're always asking, how does this impact my community? How does this impact my constituents? So they want to know. They're not always thinking about, the country per se, but how is this affecting my part of the world? So it's important for you to share your story with them so that they hear from you. And I think the last thing I can say is reiterating in terms of concrete steps, how you can become your own best health advocate. And that is ensuring that you have the best medical team around you. And sometimes that does require travel. Sometimes that does, if you're in a rural community, sometimes you may not have the technology, you may not have access to, grade A doctors, but reach out to communities like ours who can connect you and who can serve as a resource to getting to a doctor like Dr. Shepard and getting to physicians who, like I said earlier, are really to advocacy and strong patient care. So turn to your neighbor, what have you learned today, and how can you be inspired by this conversation to be your own best health advocate and to advocate for your sister or brother who may be sitting next to you?
I love that. That ties it in very nicely. So last question, actually, but a simple one. For those joining us who may have additional questions, can you let us know how they can reach out to you? Tanika, perhaps we start with you. We know we've heard about the White Dress Project. How can they learn more?
Yes, absolutely. Please, hopefully maybe there can be something that's put up on the screen, but our website is thewhitedressproject.org. There's a wealth of information about uterine fibroids. Dr. Shepard is on our advisory council. You can connect with her through our website. Obviously, she'll give you her contact as well. We're on all social media platforms at We Can Wear White. And I specifically love our Instagram because there is a community there that really is engaged and helps people feel that they are not alone. Dr. Shepard mentioned that earlier. Once you understand that you're not alone, it really just makes the journey that much easier. So on Instagram, We Can Wear White. On Twitter, we are wecan_wear white, and on Facebook, we are the White Dress Project. And once again, our website is thewhitedressproject.org.
That's great to hear. Hopefully people are taking notes. And Dr. Shepard, how could folks reach out to you?
Yeah, absolutely. Probably the best platform is on Instagram. It's at Jessica Shepard MD, which is HSEP as in Paul, HERD MD. So Jessica Shepard MD. But also, my practice, Sanctum Med and Wellness, is a concierge practice in the sense that we see people from all over. We've had people, Tanika's directed a lot of people to me when they just maybe even want a second opinion. That's always worth the time of getting a second opinion. And we do that both in person and also on telehealth. So Sanctum Med and Wellness is also on IG at Sanctum Med Wellness. That's SAN as in Nancy, C as in cat, TUM as in Mary, Med Wellness. And our website is sanctumwell.com. And, just kind of, if people want more information, the White Dress Project and myself do a lot of events. We are having an event on November 6th, and we plan on having more. Tanika and I are always on the phone talking about how we can impact our communities, and we plan on having a lot more events in 2022. So look out for those, and we always share information on shared events. So that's where you can find me.
Okay, so November 6th is the next event, it sounds like.
Yeah.
Okay, great to hear.
Yeah.
Well, I want to say thank you both to Dr. Shepard and Tanika for sharing your experience and expertise. I think we need more programs like these to create awareness about fibroids and hopefully encourage anyone suffering from this disease to seek care. So for folks joining us today, we hope you found this discussion to be informative and engaging. I know I certainly did, and I've heard them before. Thank you to the Healthy Churches community for listening in, and we hope you have a lovely rest of your day.
Thank you.
Thank you.